Okay, continuing on from that we've done the introduction to the pneumopostural correction system. The important things we want to leave you with, don't die with it in your head, is what I tell people. How to turn off your back. One position release that was formulated by Lawrence Jones will turn off migraine headaches, menstrual pain, panic attacks, 80% of back pain, including that from full-blown rupture. You will want to know this, because when your back goes out, you can lay on the ground and literally die. And don't touch me. You can go on morphine for 3 days. You can get epidurals. You can get fusions and still not be out of pain. Or you can do some of this. Yes, it's not comfortable, but yes, it does work. Trust the physics. So, before you do any continuation of exercise, always recalibrate your back. Take the pressure out, make it reset, and that starts as a good place for the entire body volume to lengthen. We're going to accomplish that now. It's going to come in, and you'll be lying on your back. We'll take the pillow, put the magnetic core inside of it so that we're using the magnetic induction. Place it underneath your head. Pull on the ropes so that the ropes mold to the base of the skull. Place your hands upon the abdominal cavity. You can lay on heat, but you cannot lay on it very long or it will make you swell. So don't use a heating pad. You can get away with using something like the microwavable heat because it's going to dissipate. So in this position with traction the neck, we've added the ground. If you're having any type of cramping, you want to test instant muscle relaxer, a little jar of vinegar, a little bottle, apple cider vinegar, 1/4 teaspoon under the tongue will stop any cramp. It automatically breaks the sodium-potassium charge on the nerve and turns it off. And it's sublingual. Hold it for 60 seconds and spit it out. You don't have to drink. Consequently, it's a good test for muscles. When in doubt, vinegar. Headache, back pain, panic attack, you name it, even tachycardia. Try the little vinegar trick. Keep it in your purse. Doesn't matter. It doesn't go bad. What? It's going to turn to vinegar? Consequently, keep it with you. To turn the back condition off, you must get the legs all the way up. But before you do that, you have some options. If you have the availability, get you a couple drinking bottles of water, microwave them, and place them hot into the groin region, across the inguinal margin. The muscle that's hurting you is coming down your back. It's the primary flexor psoas. This muscle literally is locked up neurologically as much as with connective tissue, and it's causing the pressure in the low back that blows the discs and causes you all that misery. Very often there's a lesion that forms, a piece of scar tissue, right in between these two muscles, iliacus and psoas. They're a conjoined tendon, supposed to work independently except when you have to jump away from a snake, and then they work together. But if they fuse together, they'll twist your spine. All kinds of fun stuff comes out of that. So turn your back off. Bring your legs to maximum fetal. I've had people say, oh, it hurts so bad I couldn't get my legs up there. And they went to the hospital on morphine drip for 3 days. Could have come out with staph infection. I said, did you pass out? Well, no. That's your get out of jail switch. If it doesn't make you pass out, get your legs up and turn your back off. Or just live with your ignorance. Obviously, you don't know. This will kill the signal. Poof. When you do it right, it will be, my gosh, I'm out of pain. If it still hurts, you move left or right to decrease the pressure in either psoas till there is no pain. If it hurts, you're in the wrong place. Finally, move all the way back until there is no pain. In this position, talk to Jesus for at least 10 to 15 minutes. Do not move your hands, do not move your head. It will reset. When you get up, 2 sets of switches in every muscle. One turns on if you move fast, one turns off and lengthens if you move slow. That's the one we want. The Golgi's tendon organ, the GTOs. Bring the feet down slowly. Can't stay slow fast enough. People tell me I'm fast. That's what I do. I move fast all the time. I did that years ago. They called me around Christmas from the emergency room. You got to help me. My back's out. And I saw him late that evening, and I said, you know why I'm seeing you this late? Because you like me. No, I want to know how fast you're moving. I told him I was going to bite him, and it did. In this position, using a little gravity and weight, we roll to our side and let our legs fall off. The weight of our legs helps us come up. We breathe in the nose all the way up, and we sit for a second. And we turn the feet in, lean forward, breathe in the nose, standing, and give our body 10 seconds to calibrate. This is how you turn off crippling back pain. This is one of the few times we use the microwavable heating pad. You can use it across the stomach, or you can use it laying in the back, but do not lay on heating pads that keep generating heat. They will make the tissue swell. That information will get you out of some crippling pain. Take it for what it's worth. Years of information.